Welcome to Sports Doctor. Sports Doctor is a live presentation, so we encourage you to call into the show and ask your questions on injury, rehab, training, or technique. We'll be taking your calls shortly. Call 767-8884 for your direct line to Sports Doctor. Here's your host for tonight's program, medical reporter Joe Chapana.
Good evening, and thank you for joining us for another edition of Sports Doctor, brought to you by Cross Keys Physical Therapy, with locations in Sicklerville, Woodbury, and the new Washington Township Rehabilitation Aquatic Center. Joe Chapana here, and tonight we're going to be talking about general sports injuries. We'll take your calls in just a little bit. We'll take your emails as well. But first, let's introduce our guest answering your questions tonight. We have Dr. John Salvo, who is an orthopedic surgeon with Drexel Orthopedics, and also the orthopedics for the Eagles and Flyers. Welcome to the program, Dr.
Thanks, Joe.
Salvo. Drexel Orthopedics, by the way, located in Marlton and also Philadelphia. And Dr. Salvo is right. We have Dave Anselmo, who is a physical therapist with Cross Keys Physical Therapy. And Dave, we'll start with you tonight. Spring, it's hard to believe, but it is just around the corner. Just wrapping up the month of January. People soon will be getting started in activities. What suggestions would you give to someone who is starting exercising after periods of inactivity?
Well, I'd recommend anyone that does not participate in any activity for 6 months or longer to go to the family physician, just to get a medical clearance for any underlying factors that might limit their ability to be able to participate in an exercise program, like heart problems, murmurs, osteoporosis severely, things like that, diabetes.
Okay, got to rule those out. And Dr. Salvo, when you first start exercising, is it normal to get some soreness? And how can someone tell if the soreness is from inactivity and something that was just going to go away, or if it's a serious injury?
Okay. It is normal to get some soreness, especially if you're doing something that either you haven't done in the past or you haven't done in a while. If it's sore for a day or two, say you're doing some upper body exercises, your shoulders are sore, then you want to wait a couple days, take some anti-inflammatory medicines. If it doesn't go away, or if you have swelling or severe pain, one, you should stop doing what you're doing, and two, you should see either your family medicine physician or see an orthopedic surgeon to be evaluated. Okay,
somebody does too much. They're sore. What can they do to relieve that?
One is back off what you're doing and the amount you're doing, because it's probably overuse. It's making you sore and a little bit of inflammation. Give it time, give it a couple of days. Just a general protocol of rest, ice, compression, and elevation will usually take care of most soreness. Give it a little bit of time, and if it doesn't go away, then get evaluated.
Okay, let's open up the phone lines. You're watching Sports Doctor. We're brought to you by Cross Keys Physical Therapy. Again, we're talking about general sports injuries. Maybe you're just getting started on an exercise program. Maybe you've been exercising for years and have experienced some problems. Our toll-free number is 1-888-634-7488. Locally, we have a line available too. It's 856-767-8884. And if you'd like to email your question to us, you can. The email address is wpsjtv@aol.com. Again, our guest tonight, Dr. John Salvo, who's an orthopedic surgeon with Drexel Orthopedics, and he's also with the Eagles and the Flyers. So you can talk to the same person who helps your favorite athlete get back to business. And also Dave Anselmo is with us as well from Cross Keys Physical Therapy. Dr. Salvo, with baseball and softball just around the corner, shoulder injuries are big. What kind of problems do we see with baseball and softball players?
Any kind of overhead athlete, and especially this time of year with baseball and softball starting, the two most common are elbow pain, especially in throwers and the pitchers in the inside part or medial part of the elbow, and that is usually an overuse type injury. Again, it gets inflamed, or sometimes, especially with pitchers, you can tear a ligament in the elbow. With shoulders, most of the things this time of year, especially just starting, it's still cold out and people are going to be the next few weeks getting out to start their practices. It's an overuse thing and some tendonitis, but sometimes you can injure your rotator cuff or one of the stabilizers in the shoulder.
Okay, and Dave, of course, you played college ball, University of Virginia, right?
Virginia Commonwealth.
Virginia Commonwealth, and you know a thing or two about softball, and baseball, actually, I should say. Baseball's what you play. Yeah. How can a baseball or softball player prevent injuries to their shoulder and elbow?
Well, I'm a firm believer in pre-season conditioning. I think it's real important for the athlete to get into a preseason conditioning way before they get into it, so they can specifically train for that sport. For example, at Cross Keys, we've developed a clinic for throwing athlete, in which we're looking at specifically training the musculature of the shoulder girdle to strengthen that, because we know that the shoulders are very, like Doctor just explained, it's overuse. They're very repetitive, and there's a lot of strain on the shoulder when you throw. So we actually want to train those muscles specifically so they can withstand that season and prevent injuries from occurring.
Okay, you're watching Sports Doctor. By the way, they're offering free evaluations for the next 2 weeks at their locations in Sicklerville, Woodbury, and Washington Township. We'll give you the numbers to take advantage of that at the end of the program. Right now, though, if you have a question for us, 1-888-634-7488. You can dial us up now, as John has done from Summers Point. John, welcome to Sports Doctor.
Hi, how are you?
Good, how are you?
Good. I had a question for the doctors. I'm an ex-athlete. I played sports in college and high school, and I'm a 52-year-old male and have some knee problems. And the surgeons I'm seeing are recommending viscosupplementation. In particular, they mentioned the product Synvisc. Any experience on that? What should I look for? Have the doctors had any experience with that? I don't know what to look for. I've been taking the nonsteroidals for a while to calm the pain.
Okay, what can you tell the show?
Okay. Have you had you've taken nonsteroidal anti-inflammatories, the pills, medications? Is that right?
I'm sorry, it's hard to hear you on the phone.
Right.
I've been taking. I took Relafin. I took the new ones, Celebrex, and now I'm on Bextra. But it just doesn't seem to be doing the the job.
What Synvisc is, it's viscosupplementation. So the theory behind it is you're trying to replace some of the fluid that is breaking down when you have arthritis in the knee. The lining of the knee joint is responsible for making the fluid that allows your knee to glide. When you have arthritis, especially early on, or mild arthritis, even moderate arthritis, these injections can help. They have a twofold effect. They help replace the fluid, and they have an anti-inflammatory effect too, which can take care of the pain.
Another question for him is, I don't know whether, did you go through therapy at all?
Well, I've been working out, at the gym and trying to build up my quads, but the pain is still there, and I've had some knee pain,
right.
But
one recommendation maybe land therapy might be a little too aggressive for you right now, because you have a lot of compressive forces, and especially if you're working a lot of quads. You might want to think about doing something in the water. If you go in the water, you're going to have the buoyancy of the water help to give you a little more separation while you're doing that strengthening, so you're not going to have that grinding effect on the knee joint. So it's just one recommendation. You might think about going into the water.
And of course, aquatic therapy is offered at Cross Keys Physical Therapy at their locations in Woodbury and the new Washington Township Aquatic Rehabilitation Center. And we'll have numbers to visit those centers at the end of the program, get a free evaluation. Right now, someone on our toll-free line at 1-888-634-7488 from Coopersburg, Pennsylvania. Is that right, Craig?
Yes, that's right.
Craig, where's that?
That's just south of Allentown.
Just south of Allentown. Well, welcome to Sports Doctor. Your question for our guest? Craig, are you there?
Yeah.
Oh, go right ahead with your question.
I can't hear you.
Go right ahead with your question, Craig.
Okay. My question is, I have a son that's almost 16 years old, and over the last 2 years, 2 years ago, he grew about 5 inches in 1 year. And at that point, he started to develop knee pain in one of his legs. The pain was basically identified as being underneath the kneecap, and the orthopedic surgeon had said that, well, it's because his bones and so forth, his muscles and tendons haven't caught up with the growth of his bones. Mm-hmm. But the problem is that it's lasted for such a long time, and he's unable to exercise. What I mean by that is as far as lifting weights or something like that for his legs, and it's a concern because it's slowing down his development as far as playing basketball is concerned. And I'm just wondering if there's any suggestions that the doctors might have concerning how to try to
alleviate that. Is that something he'll eventually outgrow, or?
Yeah, that's a very common problem, especially in your son's age group, because he's getting at the end of his growth spurt. And what the other orthopedic surgeon told you sounds like it's right on. As they're going through that growth spurt, it's a time of increased growth in the leg, and sometimes the muscles and tendons have to catch up to it because they're getting stretched out a little bit and causes irritation. It will go away with time. As soon as he's done growing, it will go away. I know it's kind of a tough time right now. But generally treating it with some therapy is not a bad idea if he hasn't been in it yet, because they can help him with some stretching exercises, and then some anti-inflammatory medication would certainly help him.
Craig, thank you for watching and thank you for the phone call. Let's move on to Wildwood this time. Jack, are you there?
Yeah.
Jack, welcome to Sports Doctor. Go right ahead with your question.
What do you know of what can be done for tendonitis?
Tendonitis, in what areas, Jack?
My left arm.
Left arm? Tendonitis question.
Well, basically, it's an inflammation in the arm. A lot of doctors like to treat it with some anti-inflammatory medication. But depending on your sport, a lot of times you evaluate it. There's a specific reason why it's happening. It's usually caused from repetitive motion. So, like to first of all evaluate to find out what's going on. But there's a lot of things in therapy we do with it, as far as stretching and strengthening and ultrasound and so forth. But once again, we really need to evaluate you first to find out what's causing it. Change that and then treat it in order for it to be effective treatment.
And of course, Cross Keys Physical Therapy offering free evaluations for the next 2 weeks. We'll have numbers to schedule your appointment at their Sicklerville Center, at their Woodbury Center, and at their Washington Township Aquatic Rehabilitation Center. Right now, you can call us toll-free with your questions about general sports injuries. Our toll-free number is 1-888-634-7488. Let's move on to Galloway. Dale, are you there?
Yes, I am.
Dale, welcome to Sports Doctor. What can we do for you tonight?
I recently had a shoulder injury where I had my rotator cuff torn at the gym. I was bench pressing, and I had the rotator cuff surgery, and the doctor had cut me from front to back. It was too severe for microscopic. I am 8 weeks out, and it's still making clicking noises and hurting. I've already been to the physical therapy, all this time. Did I get a second opinion?
Is that a normal occurrence from this type of surgery?
At 8 weeks out to have some clicking in your shoulder it sounds like if they opened it up and couldn't do it arthroscopically, it's probably a good sized tear. How old are you?
30.
30. Okay. And young people, it's more common to have a traumatic tear, like you had with lifting the weights. It's when you fix the tendon back, you can have some scar there that's developing and it's not mature yet, and that can account for some of the popping and clicking there. At 8 weeks, I wouldn't be too concerned about it right now. If you're getting to the 4 or 5 month mark and it's still there and all that clicking and popping is there, then you might want to think about having it evaluated again. But right now, I wouldn't be too concerned about it.
Dale, thank you for watching and thank you for the phone call. Again, you're watching Sports Doctor. We're brought to you by Cross Keys Physical Therapy in Sicklerville, Woodbury, and Washington Township. And we're going to take a short break right now, but if you have questions you'd like addressed about your own particular sports injury, our toll-free number is 1-888-634-7488. We have 3 lines open. Also, you can reach us on our local line at 856-767-8884. You can email us too. Email address is wpsjtv@aol.com. More of your questions, more of your calls right after this.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
Sicklerville, Washington Township, and Woodbury. Call in.
Imagination. It may be the most precious of natural resources. To a child, playtime is a rehearsal for the real life they will one day inherit from us. How will they handle the challenges? What choices do they make? Who do they pretend to be? Love that part of your child that longs to daydream. Don't underestimate the power of play.
It is Sports Doctor, brought to you by Cross Keys Physical Therapy in Sicklerville, Woodbury, and the new Washington Township Aquatic Rehabilitation Center, offering free evaluations for the next 2 weeks. We'll give you numbers at the end of the program to schedule your appointment. Tonight we're talking general sports injuries. With us tonight to answer your questions, we have Dr. John Salvo, who's an orthopedic surgeon with Drexel Orthopedics in Marlton and Philadelphia. He's also with the Eagles and the Flyers. And Dave Anselmo is with us, too, from Cross Keys Physical Therapy. He is a physical therapist there. Toll-free number is 1-888-634-7488. Our email address, wpsjtv@aol.com. Talking about the knee, talking about the elbow, let's talk about the shoulder. Dr. Salvo, it seems to be one of the more commonly injured parts in athletes. Why is it so vulnerable to injury?
Well, the shoulder, just the way we're all built in and of itself, the bony restraints are not great. You really depend more on your soft tissue restraints and your muscles, especially your rotator cuff and your deltoid muscle. It's the most mobile joint in our bodies, so with that it's also going to be susceptible to injury because you're really depending on your soft tissues more than your bones to keep it stable.
Okay, and one of the common injuries you hear with the shoulder is a dislocated shoulder. What treatment options are available for a person who has done this? And what factors come into play when you're deciding how to treat the athlete?
What you want to know is it a first-time dislocation or is it a recurrent dislocation, and how it happened. They basically break down into either traumatic or atraumatic dislocations. A traumatic dislocation happens such as in football or a fall, hit your arm and your arm pops out. That usually is a tear of the main stabilizer in the shoulder. If it is not from a traumatic injury, some people are born loose ligament and have really a great range of motion in their shoulder and can end up with some instability. Those people usually don't need any kind of surgical intervention, but the traumatic ones, especially if it's recurrent, need to be addressed.
Okay, let's go back to the phone lines. Toll free, we are 1-888-634-7488. Peggy joins us from Clayton. Peggy, welcome to Sports Doctor. How are you tonight?
Hi, I'm fine. I'm calling for my son. He's 40 years old, and he runs a floor waxer. And his left elbow gets a lot of pain in it, and it was swollen up for about a week, and the swelling went away, but it keeps coming back. Is there anything he can do for that in therapy?
How did he injure that again?
He runs a floor waxer.
Oh, okay.
And he has another thing that I'd like to know if there is any kind of therapy for. He has a herniated disc in his neck.
Mm-hmm. Okay, herniated disc and a...
He would be a good candidate to come in for the free evaluation so we could take a look at it. Because it might be a combination of a couple of different things that might be causing this thing. It might be a fact that he might just have poor posture around his shoulders, that we need to make some corrections on that could take some pressure off his neck and his shoulder. Because we know sometimes the pain that maybe goes down your arm into your elbow, into your wrist, can also be coming from your shoulder. So I'd highly recommend you to come in for the free evaluation so we could take a look, and might be something very minor we could give some instructions on, or we need to refer him to Dr. Salvo.
And Peggy, we'll have numbers for you at the end of the program to schedule your appointment or your son's appointment for the free evaluation. Seems to be people who are in jobs with repetitive motions over and over again, they seem to be prone to a lot of orthopedic problems.
That's right.
Talking about like a person who's a floor waxer, there are other jobs too. People who work over the head.
Right.
Yeah,
that kind of stuff.
It's a very common thing, like you said, the repetitive motion, the overuse type injuries, and it can just lead to inflammation and tendonitis, and that can really, sometimes it can be debilitating.
Okay, we're about a couple weeks now, I think, maybe days from pitchers and catchers reporting, just about that time of year. And Dave, when you watch pitchers, you always see them iced down after they're throwing. Is this really important, or is this just for show?
No, it's definitely not for show. Once again, we talk it all night long. It's a repetitive motion. When someone goes out in the mound and starts to throw, I mean, more than likely they're throwing a ball 80 to 120 pitches a game, and that's very repetitive. Inflammation does form in the shoulder joint, and we want to cool that joint down and prevent it from getting inflamed and prevent any further damage from occurring. So we definitely want to ice that down for 20 minutes at least, 20 minutes on, 20 minutes off.
Mm-hmm. And pitchers always get a lot of attention for their arms. What about catchers and their knees?
Well, yeah, I mean, once again, they're getting up and down. It's a repetitive motion. So if they're having pain in their knees after the game and seeing some swelling, I'd highly recommend them to ice it as well.
Okay, we got a few minutes left. You're watching Sports Doctor. If you have a question tonight, general sports injuries, you can reach us toll free, 1-888-634-7488. Locally, it's 856-767-8884. If you'd like to email your question to us, we'll check our email in just a few moments. It's wpsjtv@aol.com. Again, Cross Keys Physical Therapy offering free evaluations for the next 2 weeks at their Sicklerville Center, their Woodbury Center, and their Washington Township Aquatic Rehabilitation Center. We'll give you the numbers at the end of the program to take advantage of that offer. Dr. John Salvo is with us, and Dr. Salvo, what is a torn rotator cuff, and is it the same as a labrum tear?
No, the rotator cuff is a group of 4 muscles that forms a cuff around your shoulder joint, and it allows a lot of the overhead activities such as raising your arm up, reaching behind your head, reaching behind your back. The labrum is actually a soft tissue stabilizer inside of the shoulder joint. So the labrum is more responsible for the stability of the shoulder, and the rotator cuff is more responsible for motion.
Now, what treatment options are available for someone with a torn rotator cuff? Is that always surgery?
No, it's not always surgery. It depends on, again, how the tear happened, how big it is, and your age. Younger people generally don't do as well without getting a tendon fixed if it's torn completely off. Older people, as you get over the age of 60, 65 years old, it's very common to have a rotator cuff tear and you don't even know how it happened. And a lot of those people can do very well with non-surgical care, therapy, medications, and some time.
Okay, Sports Doctor brought to you by Cross Keys Physical Therapy in Sicklerville, Woodbury, and Washington Township. We're about ready to check our email, but first let's take this short break. More of Sports Doctor when we return right after this.
Sports Doctor will be right back.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
Sicklerville, Washington Township, and Woodbury.
Sports Doctor, thank you for joining us tonight. Joe Chapana here. We're brought to you by Cross Keys Physical Therapy in Sicklerville, Woodbury, and Washington Township. They're offering free evaluations for the next 2 weeks. We'll give you the phone numbers to schedule that in just a few moments. If you'd like to call us toll-free with a question, it's 1-888-634-7488. We have Dr. John Salvo with us, who is an orthopedic surgeon with Drexel Orthopedics in Marlton and Philadelphia, and also an orthopedist for the Eagles and Flyers. Dave Anselmo joins us too, a physical therapist with Cross Keys Physical Therapy. Our questions from email tonight. A skiing question, first of all. How can I protect my knees from injury on the slopes this February? Any suggestions for this person?
Pre-season conditioning. You should prepare 3 months ago. That's how you could definitely prepare and prevent injury from occurring. If you're a skier and you know you're going to ski this winter, you should have been preparing over the summer, doing a lot of lower extremity stretching and strengthening. Really strengthening the quads and the hamstrings, and of course the hips and the back. You really want to do a lot of abdominal stuff. So pre-season conditioning, if you know you're going to do that, the best way to prevent injury is prepare for it. Prepare for your sport that you're ready to go into.
Train in the fall for skiing. What's more dangerous, or maybe it's the same, skiing or snowboarding?
Ooh.
I think you get different kind of injuries with the others. Snowboarders is very common to get wrist injuries, wrist fractures, upper extremity things, because they're more likely to catch an edge and to fall either forwards or backwards, and it's a natural tendency to try to use your hands to brace yourself. Skiers are more commonly to get knee injuries because you're not connected to one board, and you can catch a rut, and one leg can go one way while the rest of your body goes another way.
Interesting. Got a question about tennis, I believe. Yes, from Cape May County. Ed writes, can reoccurrence of tennis elbow be prevented, and what steps should he take to avoid reoccurring tennis elbow?
Should definitely come down for the evaluation. One of the first steps of tennis elbow or any kind of tendonitis that you have, especially if it keeps coming and going, is make sure that you're getting evaluated. Therapy is probably the first 5 or 6 options for tennis elbow, along with some anti-inflammatory medication. If you get on an exercise program and it works, common thing is people stop doing the exercises when it feels better. So I think therapy is a good first step for that.
Okay, and JJ from Vineland writes, what do you suggest? I hurt my knee running last fall. I have been resting all winter. I feel good. Should I start at the same distance as where I stopped, or should I build up again? Who wants to hammer this one?
Dave?
Well, you should start definitely not at full. You should work your way back up, just like anything else. You want to work in slowly and build yourself up to the pace you were at before, the distance you were at before. So I would say work at a third of that, and when you start feeling that's real easy, build yourself up to half of your distance, and then build yourself up. You'll know. I mean, if you're a runner, you'll know when you're ready to go to the top, but never go right back to where you were. It's just not a good idea.
Okay. Back to Ed's question. He was bringing up tennis elbow, and you hear a lot of tennis elbow and golfer's elbow. Dr. John Salvo, what are the medical diagnoses for these common sports injuries?
Well, the general terms of a tennis elbow and golfer's elbow have to do with either, both of them are tendonitis. It's on different parts of the elbow. The tennis elbow is lateral epicondylitis, or it's on the outside part of the elbow. Usually you have a problem with grip and raising your hand up. The golfer's elbow is more on the inside part of the elbow, right by your bony prominence there. It's the same kind of symptoms. It's pain, it's inflammation. You can have some pain with grip, but the difference between the two is the side of the elbow.
Okay, let's talk about the free evaluations being offered by Cross Keys Physical Therapy. If you'd like to take advantage of these offers, all you have to do is schedule your appointment. We're going to put the numbers up on the screen. In Sicklerville, you can see the number is 856-728-1900. In Woodbury, it's 856-853-0988. And in the new Washington Township Aquatic Center, it is 856-374-3707. And check out their email address too, or actually their website at www.physicaltherapysite.com. I want to thank Dr. John Salvo for being with us tonight.
Thank you.
Again, he's with Drexel Orthopedics and also an orthopedist for the Eagles and Flyers, and also Dave Anselmo with us, a physical therapist from Cross Keys Physical Therapy. We will be back 2 weeks from tonight, February 13th, Thursday night, 9 p.m. Dr. Neil Kahanovitz, am I saying that right? Past president of the North American Spine Society, director of orthopedic spine services at Drexel University College of Medicine, will be joining us to answer your questions about the spine. Until then, for Cross Keys Physical Therapy, I'm Joe Chapano. Stay well.